Well, Labor's new 60-day drug dispensing policy could force aged care residents to pay more than $800 a year for their weekly medication. According to financial analysis commissioned by the Pharmacy Guild, more than 180,000 elderly Australians receive their medicine individually portioned in the form of Webster packs. However, due to the new reforms halving the dispensing fees, with pharmacies losing up to $158,000 a year, the pharmacy sector won't be able to cover those costs. Well, joining us live now is the Pharmacy Guild Vice President, Anthony Tassone. Anthony, good to see you. Thanks for your time this morning. So just explain that loss that aged care residents now face. Why is that?
Look, firstly, Peter, we all want the same thing in terms of cheaper medicines for Australians, but this rushed and poorly consulted policy from the federal government will see that from September 1, that there will be a $4.5 billion cut to pharmacy remuneration over the next 4 years. And these government cuts are going to result in patients in residential aged care having to pay more for their services from their local pharmacy in terms of the packing of Webster packs, these dose administration aids, and being delivered to the facilities. And up until now, patients haven't had to pay for these services from their local pharmacy, getting their packs organised and delivered. But these cuts that are going to come in from September 1 will result in patients having to pay for these services from their pharmacy. And what we're asking the government to do is to pause, not stop, but pause the rollout of 60-day dispensing, consult more, and make sure we get this right.
Okay, so let me get this straight. To recoup some of your costs, you're going to target some of our most vulnerable.
What we're saying is, as a result of these cuts from the federal government without consulting the sector, not consulting community pharmacies, not consulting aged care, pharmacies will have to charge patients for these services that they haven't had to up until now. Government cuts are leading to patients having to pay for these services from their local pharmacies, because up until now, pharmacies have been able to provide these services at no charge in terms of deliveries and packing of Webster packs. The cuts that are coming in from this government from September 1, $4.5 billion over 4 years, it will result in job losses, reduced trading hours, reduced services, and patients having to pay more for their services. But we need to have a pause, consult, and give us more time to get this right. So that way, with the consultation, with the aged care sector, with community pharmacies, that we can ensure that patients aren't worse off, that aged care isn't worse off, and that we get cheaper medicines right, because we all want cheaper medicines.
Okay, yeah, but that point and that question still remains. To recoup some of your costs, you're targeting some of our most vulnerable.
In terms of the cuts that we're experiencing through pharmacies from September 1, there will be job losses, there will be reduced training hours and services unless there's a rethink here and more consultation to get it right. And these patients that are in residential aged care, 91% take 5 or more medicines and 74% take 9 or more medicines and actually won't financially benefit.
Right, yeah, right. I mean, there's a reason for that, because they need them.
Absolutely, they need them, and they need them organised in the right way in Webster packs so that they take the right medicine at the right time, in the right dose.
So these increased fares, do they just relate to aged care, those who need their medicines delivered, packed and sent?
There are older patients who are ageing in the home that also get their medicines packed and delivered to their homes in the local community, and pharmacies are reviewing what they will need to charge for these patients as well because of the cuts from the federal government. These cuts that are coming in because they're rushing a policy, are not consulting, and we're not doing it the right way to get cheaper medicines without the unintended consequences. We will have this perverse outcome where patients who are older, vulnerable, sicker, not financially benefiting from 60-day dispensing because they're not actually saving money, they're reaching their safety net free list later in the year, not financially benefiting, they're cross-subsidising the convenience for healthier, wealthier Australians. We need to pause, we need to consult, we need to get this right. So that
this seems pretty heartless to me, though, I've got to be honest with you, if you're targeting our most vulnerable.
There is absolutely no targeting. Up until now, pharmacies have been providing these services at no charge because they've been able to do it from the dispensing funding we've had. When you have 50% of your dispensing remuneration on the most commonly dispensed medicines halved without consultation, without it being done the right way, we have these unintended consequences. But if we can pause, consult more and get it right, we don't get these unintended consequences and we get cheaper medicines the right way.
Would it still be cheaper for them just to go and pick it up or allow someone to go and pick it up on their behalf?
Patients in residential aged care facilities will rely on, and they have relied on, pharmacies delivering it to them. And it is really difficult to manage it any other different way with medicines not being organised and packed that way and not delivered. We have a system and a sector, aged care sector, that is already in crisis with staffing shortages, trying to make sure they have nurses 24/7. This is another tax on aged care that's come out of nowhere because the government hasn't consulted on their cheaper medicines policy. That's why we need to pause and consult.
Is this
more.
another pitch? Are you trying to pitch for more money, for more government subsidies here when it comes to the amount it costs pharmacies to pack and send?
We're saying that we need to do it right. We all want cheaper medicines, but rushing policy, major reform without consulting aged care sector, community pharmacies and patient groups and having these unintended consequences is not a good outcome. So that's why we need to get it right and we need to consult more and just hit pause for now.
In the meantime, you're targeting our most vulnerable.
In the meantime, pharmacies continue to service 188,000 patients in residential aged care facilities, delivering excellent service and been absorbing the cost themselves. The true cost of that service is being absorbed through the pharmacies and funded through dispensing remuneration to make sure that patients get the right medicine in the right dose at the right time. But that's at risk if we don't get cheaper medicines the right way.
Is there another option though? I mean, is there another way to recoup some costs rather than taking on aged care residents?
If we don't have a rethink of this policy, there is going to be job losses, reduced trading hours of pharmacies,
no other way.
Pharmacy closures. There is already pharmacies that have closed. Montville in Queensland is an example because there has just been no other option for them. And we don't need it to have it this way.
Right,
we don't need these unintended
is there not another way? I just can't believe you're taking on aged care residents.
If there was another way, then I wouldn't be here talking to you, Peter. I would not be here talking to you, but instead I'm talking to you.
But do you feel good about this? I mean, do you feel good about this, taking on aged care residents, increasing costs for them?
The government has rushed and not consulted on a policy, and this is unintended consequences that happen. We told them months ago of this, the Department of Health, that pharmacies just cannot continue to service residential aged care unless there was a charge put onto the patients. And that's all as a direct result of cuts that have been inflicted by the Labor government. But it doesn't need to be this way. That's why. Let's just pause and consult more. The Department of Health's own impact analysis report on this 60-day dispensing, as reviewed by the Department of Prime Minister and Cabinet, said that there was not sufficient consultation for the government to make this decision, that there needed to be more consultation. So that's what we're calling on. And surely that's a good thing, the right thing, to speak to the sector, to speak to aged care and to speak to patient groups so that we make sure we do cheaper medicines the right way without aged care and patients being worse off.
I mean, they've already got so many issues. Aged care's got so many issues to deal with at the moment, and that's one sure that they wouldn't have to deal with. Increased expenses coming from pharmacies.
And through roundtables that we've had with the aged care sector, Peter, they're worried about this as well because it's with no warning. This 60-day dispensing and the negative unintended consequences have come out of nowhere. They haven't been consulted. The federal government, the Department of Health, they haven't consulted with aged care, but that's what we're calling for here.